Welcome to Mom Lounge TV. I'm your host, Shenina West. Today, as my guest, I have Richard Pass. He is a registered nurse and a health educator. He's been practicing basic and advanced CPR for almost 20 years. When Richard decided to take a simple yet educational program to the community, he founded Save a Little Life. Welcome, Richard.
Thank you for having me.
Oh, thank you for coming. Richard, I did discover you when I was 8 months pregnant, when a friend of mine had said to me, you have to take this program, Save a Little Life. Richard, so I'm very excited that you're going to do an infant CPR demonstration for us today. Please, I'll let you take away, and I'm so excited to learn once again from you.
The 2006 guidelines, that are international guidelines for CPR, have put the focus not so much on the breathing, but much more so on the chest compressions. Because we found that good quality chest compressions, pumping down and then releasing, of course I'm doing it in slow motion, pumping down and releasing, creates a vacuum, especially upon what we call recoil, where the chest snaps back. And that recoil of the chest wall brings oxygen into the body in a much more efficient way than should we just blow air in. So previously, prior to 2006, the guidelines were 5 pumps on the chest and 1 breath. That's been increased now to 30 pumps, 30 pumps, followed by a couple of breaths. And that obviously puts a lot more emphasis on the quality of chest compressions. And in fact, when we look at chest compressions, and we look at the body itself, if we look at the depth of the chest wall, the new guideline reminds us that in order to be effective in this pumping format, that we need to pump down at least 1/3 of the depth of the chest wall, and even down to a half, and you can still be safe. So in order to get this done, we need to pump down pretty fast and pretty deep. And keep in mind that all people who are unconscious usually have something going on with their breathing tube, and that problem is really the tongue itself in the base of the throat. The tongue sits very close to the opening of the breathing tube, and when the person is unconscious, the tongue tends to flop down over that. So after we stimulate the baby to see if there's any response, we tilt the baby's head back, and this is true for all victims, and this may enable the victim to breathe on their own. So we do look at the chest for any rise and fall. We do listen and feel for air. And in a few seconds, if there's no response, we are asking you still to blow in a couple of breaths. This is the last and final little act prior to pumping. We start with a little stimulus, check and see if they can breathe on their own. If not, cover as many of these 3 holes as you like and get the simple response that we're looking for, which is the rise and fall of the chest wall. It looks like this. So now we've got a situation where someone has not responded to the stimulus, they haven't been breathing at all on their own, they receive 2 breaths from us, and they still look awful. It is time to start pumping. Right between the nipples, in the middle of the breastbone, pumping down 30 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Back and forth, back and forth. And again, if I were alone, I would do up to 2 minutes or about 5 cycles of this CPR before I took off and went to make that phone call. Obviously, if you were here or somebody else was here, you would be off to make the call, and preferably getting that telephone and bringing it back, a cordless landline that we could use, okay? And so basically, we're doing some simple steps, little stimulus, check for breathing, a few breaths, and start your CPR. Don't be afraid. CPR does not hurt people. If they need it, this is a life-saving act.
So this is in the case where they've drowned, they've inhaled water. Essentially, that's what's happened, is water has gotten to the lungs. So in the case that you do revive them, they're spitting up the water after? And what do you do to prevent them from choking on that water, and they're kind of obviously coming out of a state of being unconscious?
Sure. A good question. I think it's also important that we review and sort of revise our thinking about drowning. We used to have different ideas and concepts about it. It turns out that drowning is not, in fact, an airway obstruction per se. and that drowning victims, much of the water in drowning victims, at least initially, goes into their stomach. So CPR for drowning victims, even though it's identical to CPR for people on dry land, is not intended to get water out of people. But if water comes out, it will usually come out in the form of vomiting.
Oh, okay.
In other words, water gets in the stomach and a spontaneous vomiting often occurs. And if that happens, let's say I'm pumping away on this baby, and again, the same CPR, dry land or water related. If the baby starts to vomit, I'm going to roll her toward me. I'm going to basically kind of support her. I'll turn so you can see what I'm doing, but I would basically scoop the mouth out of anything that was in it a couple of times, put her back down, see if I can get a breath in, then I would go right back to pumping just like I would otherwise.
Oh, you wouldn't stop to wait to see if the baby started breathing on their own?
No, I wouldn't stop. In the course of doing this, at any time, it is possible there could be a spontaneous return of consciousness and breathing, which is, of course, our hope. And that's why I said earlier that we have to act immediately and quickly. But I think it'll be pretty obvious. People will start to usually cough and spit up some, but the breathing will usually start spontaneously, and of course then we can stop the CPR if those signs of life return. But it is still a critical situation, and in that set of circumstances, we're waiting for the paramedics while we watch this baby very carefully. You may want to sit them up a little bit once they return to a state of consciousness. But this is still a very critically ill person, and they need to be taken to the hospital by paramedic ambulance as quickly as possible.
We're still talking about drowning victims, and now we've moved from an infant to, I would presume, a toddler or a very young child. And again, we're going to be focusing on what the similarities are, but I guess you were mentioning there are slight differences on how you would treat a young child versus, obviously, an infant. Mm-hmm. And I'm looking forward to your demonstration.
Sure. I want to focus on the fact that those simple steps that I used with the baby are also followed here. If we found someone, whether they were pulled out of water or found perhaps in a sleeping space or anywhere, unresponsive and looking very, very ill, we'll start with stimulation of the baby or child in this case, an attempt to see if they can breathe on their own. We don't see anything. Now you have an option here. You can either pinch the nose and breathe through the mouth, or you can breathe through the mouth and not pinch the nose. But the key, of course, is getting the chest to rise and fall. And if you've done that a couple of times, just like with the baby, and there's no response, then locate the nipple line, the middle of the breastbone. I'm using this little nubbin of bone on the side of my hand, and I'm going to drive straight down 30 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. And back again, 30 pumps, 2 breaths, 30 pumps, 2 breaths. If this little one were to vomit, just like the other one did, I would roll them toward me, stabilize them as best I could, scoop the mouth out, probably try to get a test breath in, see how we are here, and if need be, continue CPR, keeping in mind that if this were a drowning victim or just someone who was found this way, our hope and our expectation is that CPR provided this group, this age group, would actually hopefully bring them back to life.
Exactly. SaveALittleLife.com. There you'll find Richard's online calendar. So if you're in Los Angeles or visiting the LA area, please go to his website, see the online calendar, and see if you can take one of his classes. And don't forget about his DVD. You can have that on file as a reference. But please, I honestly do recommend taking the course. And if you cannot access Richard, research your neighborhood or your community and find out if there's a place where you can take a CPR. The life-saving course that, of course, can save your own children and someone else's.
Absolutely.
Thank you, Richard, for joining me this evening.
Thank you very much. My pleasure. Yes.
Most certainly. Well, thank you for watching Mom Lounge TV. I hope that you found this as educational as I have. Have a good day.